Mesdames et messieurs, bonsoir.
Hello, everybody.
On m'entend bien?
Hope you hear me well.
Oui, on t'entend depuis Lomé.
Très bien.
Yes, we can hear you from Lomé.
Donc, je crois qu'il est 14h33.
So I think it is 2:33. We're going to start the webinar. So, hello, ladies.
Je suis le spécialiste communication pour Pathfinder au Burkina
Communication for Pathfinder in Burkina Faso, and I welcome you in this virtual meeting, which is the first of a series of 4 webinars focusing on the USAID subsidized AmplifyPF with the help of a Pathfinder in Burkina Faso, in Côte d'Ivoire, in Togo,
Le thème global de
and
ce
Niger. This webinar will be about the adaptive management of postpartum practices in various contexts. So there will be specific webinars per country which will strengthen this webinar. So today, we are going to talk about the contribution of non-governmental healthcare facilities in the offer of family planning services in Burkina Faso. And the moderator of this first webinar, I'm happy to introduce Dr. Karim Abdul-Jiro, a specialist of health in Burkina Faso for USAID. He supervises women's health and reproductive health program. He obtained specialization in the National University of Taipei in Taiwan, and he has 15 years of experience in a development, follow-up, and assessment of health programs. Dr. Giro, I will give you the floor to present the other panelists and be the moderator of this webinar. Welcome. You have the floor. Thank you very much, Mr. Barry. As you know, the Amplify project is in last year of implementation, so it is an opportunity to capitalize on good practices with high impact practices which were implemented in many countries, and especially 4 countries: Togo, Côte d'Ivoire, Burkina Faso, and Niger. And this is also a good opportunity to show how the project was adapted to the context during its implementation. And in Burkina Faso, it will be the contribution, like Mr. Barry said, of the non-governmental healthcare facilities in supplying services, PF services in intervention areas of the Amplify project. So we have a panel made up of high-level manager of the project implementation in Burkina, mostly Ms. Giselle Cabore. She has the training as a social psychologist, and she has more than 20 years of experience in social action and implementation of projects and program about health of reproductive health and family planning, focusing on young people and teenagers. Ms. Giselle, before working for Pathfinder to work on this project in Burkina Faso, she worked at the Population Council. Then we have Dr. Adima Nakwano. He is a health public health doctor as a training. He has almost 30 years of experience in developing and implementing family planning and reproductive health programs in West Africa, especially Benin, Mali, Niger, Burkina, and so on, working with USAID and the Global Fund. Dr. Taquano is the head of the project AmplifyPF in the 4 countries that were mentioned. So I welcome you all to this webinar. Now, we are going to talk about the theme of the webinar, to ask Ms. Giselle to make a presentation on the contribution of non-governmental health facilities in the offer of family planning services in Burkina Faso. You have the floor. Thank you, Dr. Giro, and hello, everybody. Our presentation today will focus on the role of non-governmental health care facilities in the intervention area of the Amplify project. So in the field we have healthcare facilities which received assistance, and we had a window of opportunity in which we invest in order to strengthen their capacities in order to offer services to the population. Next slide now. So this project is the AmplifyPF project on family planning implemented in 4 countries: Burkina Faso, Côte d'Ivoire, Niger, and Togo. The project is funded by USAID, and the duration of the project is 5 years, and it is being implemented by Pathfinder and the Population Council. So there are several fields of intervention: family planning, reproductive health, and family health, child health, and nutrition. After the political event that intervened in Burkina in January of 2004, the funder asked that there will be no help to public health care organization in application of US law. So the family planning support cannot help the public sector. So in this context, we started an intensive support to non-governmental healthcare facility starting in May 2022. How did the implementation of this initiative? Well, it was initiated in 57 non-government healthcare facilities out of 81 such healthcare facilities identified and spread among 4 health districts, Buli, Mugu, Boromo, and Dafra. What were the targets? It is, as I said, the non-governmental healthcare facilities, healthcare service provider, and a population, especially young people, women, and children. The goal of our presentation is to show the involvement of non-government healthcare facilities for the offer of family planning services. We wanted to show the contribution of those non-governmental healthcare facilities in the offer of PF family planning services in the zone of intervention. So what was accomplished in concrete terms? There were several interventions. First, there was the strengthening of capabilities and skills of service providers in family planning for more than 350 healthcare service providers. And it was about technical themes, about how to increase supplies, how to identify the needs of clients, and also in order to generate high-quality data. In addition to that, we strengthened the technical background of this 57 organization in medical and technical equipment. It was equipment in order to use contraceptive methods in order to to prevent infection and manage infection and so on in connection to IUD, for instance. In addition to that, we helped generate high-quality data, and all along the project and our intervention, we supported these healthcare centers in order to ensure high quality of services and data, and to be sure that the data are transmitted to the higher level. So the approach was about collaborating with officially recognized healthcare organizations which work with the Ministry of Health. So we had to identify the needs of these facilities, and we provided support based on the needs as identified. And during the implementation, we also supported those healthcare facilities in collaboration with other partners of USAID, which are active in the supply chain through the supply of contraceptive product. And then we organized special days of free supply of contraceptive and family planning products. So it is the first time we had a project of this size targeting non-governmental healthcare facilities. And once that those organizations became involved on the offer of free family planning services to population, things developed, and this is what happened in the field. And we noted that those non-governmental healthcare facilities manage a large part of the population. If you see here the slide on the screen, we are interested, we show the part of the population which use these services through non-governmental healthcare facilities during a specific period, and we see that 22% of the population benefited from those services of these healthcare facilities for consultation or about health of newborn and also family planning. So we're able to help this organization to help them supply high-quality services to the population. And these organizations are placed in areas where there is a high population which is interested.
Intervention was possible through the synergy of actions via the Amplify project and USAID project for the procurement of contraception. And I'm also going to speak about GBSN because they provided for free contraception to those health facilities, and was enabled to create or to set up days of free services and providing free products. They helped in the logistical management of the project and also breakthrough actions, which was involved in the creation of demand. So as you can see on this slide, what was the contribution of healthcare facilities in those areas? As you can see, we can see that the intervention started April, July 2022. And right after this, the next semester, and thanks to Amplify and its partners that intervene into the logistical procurement chain, the health facilities received products, contraception products, and therefore they organized days where they would provide free contraceptions to populations. This really helped increase and boost the key indicators, as you can see on the slide. The non-governmental ones did not have the opportunity to get those free days or those free products during National Week, which was organized in November by the Health Ministry. So this basically calls our attention to the need for those non-governmental healthcare facilities to have access to these type of products for family planning purposes. This slide shows the contribution of those healthcare facilities for postpartum family planning, which is basically family planning 48 hours after delivery. After 2 semesters after the beginning of the intervention, you can see an increase of the indicators. So when we observe the numbers, we noticed that those healthcare facilities did not necessarily report the data related to postpartum family planning. And therefore, after the coaching and the training that happened, those indicators are constantly reported afterwards. And this could possibly explain the numbers that we can see on the slide. So here's the same situation that has been observed, which happened in the post-abortion family planning at the very beginning of the intervention. The indicator was not necessarily reported or collected. So what were the lessons learned? We experience a strong commitment of non-governmental healthcare facilities because it's also a great opportunity to strengthen capacities, not only to offer services to family planning, but also increase the quality and the reporting of data. So it's not just about providing services. It is about providing good services and being supported to do so. And we've also noticed an increase of visits when those services are provided, family planning services are provided for free during those special dedicated days. Additionally, in terms of lesson learned, here is where we could do better. 2 points. So first of all, the mobility of the staff that's being trained. So for example, in from November 22 to March 23, we received the information that at least 12 service providers left those original healthcare facilities. The second point is the hardship to have access to those contraception products in the different warehouses. What were the challenges that we experienced? So accessibility to those healthcare facilities was 1 point. We think that this issue is being resolved right now because the Ministry of Health has authorized the healthcare facilities to register and report the data collected in terms of district procurement. So basically what it means is that there will be better visibility of data that will be shared in terms of supply. Second point is the reduction of the financial barriers. This is usually not a free service. So we think that this could be an element that could enable healthcare facilities to provide services. The second point is the maintenance of services of quality because of the mobility of service providers. So in terms of recommendations now, we think that the people who are interested by such initiatives should sign conventions, collaboration conventions with these type of healthcare facilities and encourage partnerships. We also should encourage the signature of conventions with the Ministry of Health to enable free services, free family planning services. And of course, lastly, do advocacy work in 2 districts. So that's the initiative that we wanted to share with you today. This approach was implemented in 4 health districts in Burkina Faso, but also in other districts. There are other healthcare facilities that are non-governmental. And we think that sharing this initiative should provide necessary and interesting information to replicate those in the interest of population. Thank you so much. Dr. Guiraud.
Monsieur Barry.
Monsieur Barry, you have the floor. Thank you so much. So to support this presentation, we also prepared a movie, a 5-minute movie that shows how the Amplify project had an impact on those regions in Burkina Faso. It lasts 5.5 minutes, so please watch it before we can move on. Please go ahead, you can play it.
AmplifyPF a été d'un grand soutien pour nous parce qu'ils ont mené beaucoup d'activités avec nous qui nous a permis l'ouverture plus large avec les clientes en matière de planification familiale.
Si Amplify n'existait pas, il fallait alors le créer.
Le projet Amplify nous accompagne non seulement sur le plan de la formation, ça a permis de recycler toutes les sages-femmes qui travaillent dans notre structure. Cela a vraiment contribué à améliorer considérablement la prise en charge de nos clientes dans notre structure. Parce que ça a permis de mettre à niveau les sages-femmes qui travaillent ici sur les nouvelles directives que notre ministère a adoptées en matière de prise en charge, de planification familiale.
Sur le terrain, pratiquement, ils viennent avec un mentor pendant nos journées de santé, nous appuyer dans l'insertion et même également dans la technique également de la planification familiale. Et ça, c'est une chose qui est vraiment très bien. Donc, ça augmente alors la connaissance des agents de santé.
La formation a été bénéfique pour nous, voilà, puisqu'il y a certaines choses qu'on ne pouvait même pas faire. Et l'implant, non, je ne pouvais même pas insérer ça. Voilà, grâce à la formation, j'ai pu insérer. Il y a le DUPP aussi, que je ne pouvais pas faire. Donc, j'ai pu faire. Et puis, bon, les autres que je pouvais faire aussi, il y avait des erreurs. Voilà, je me suis rattrapée, en tout cas grâce à la formation.
AmplifyPF, par exemple, a organisé des journées de gratuité en planification familiale qui a été une première pour nous, étant un service privé. Donc là, on ne parle pas de gratuité dans le secteur privé, mais AmplifyPF nous a permis de mener cette activité et qui a permis à beaucoup de clientes de bénéficier de l'offre en planification familiale.
Quand nous prenons au niveau des structures de santé privées comme le nôtre, le CSP Solidarité, il y a alors l'appui en matériel médico-technique. Avant en tout cas l'accompagnement de Amplify Pathfinder, nous n'avons pas reçu d'accompagnement en matière de dotation, en matière de formation continue de la part de l'État ni d'un projet. Donc c'est la première fois que nous bénéficions de ça.
AmplifyPF nous a doté de matériel et matériel médico-technique.
Notamment des tensiomètres, des poupinelles.
Également, boîte d'insertion d'implants et de retrait d'implants. La boîte de retrait également de DIU. Et aussi le matériel, la table. On a reçu une table gynécologique, un paravent pour respecter la pudeur des femmes.
Au tout début, pour moi, j'avais peur de la planification. Mais quand je suis venue, j'ai d'abord fait un essai, je suis venue, on m'a encouragée. Après encore, je suis revenue, la tante m'a encouragée. Et c'est le stérilet que j'ai utilisé. Par la suite, quand j'ai voulu enlever, elle m'a dit de revenir. Et c'est encore elle qui a enlevé. Après encore, je suis revenue, c'est quelqu'un d'autre. Parce qu'entre-temps, je m'étais habituée à mamie. Et j'avais peur que quelqu'un d'autre, mais tout était bon. Ils sont tous bien formés et c'est parfait.
Il y a aussi les conseils qu'on nous donne ici. Donc, ces conseils-là nous sont très bénéfiques. C'est ce qui nous pousse également à venir ici.
Amplify nous a en tout cas accompagnés dans le renforcement de compétences de nos acteurs du secteur public et également aussi ce que nous avons positivement apprécié, c'est vraiment l'implication du secteur privé dans l'offre de services de SR de façon générale avec la planification familiale. Donc grâce à l'accompagnement de Amplify, nous avons pu en tout cas former des agents de santé au niveau du privé et également aussi doter certaines formations sanitaires en matériel pour pouvoir faire des insertions et retraits dans le cadre de la planification familiale.
Ils ont été d'un grand soutien, donc on voudrait que ce partenariat continue dans le cadre de la formation et recyclage surtout des agents. Comme je l'ai dit au départ, je me retrouvais seule pour placer le DIU. Maintenant, l'offre est permanente.
Notre ministère vraiment fait des efforts dans le but d'améliorer la santé de la population. Donc le secteur privé aussi, c'est dans ce même but que nous travaillons. C'est pour améliorer aussi la santé de la population. Donc en quelque sorte, nous accompagnons l'État dans son effort de satisfaire la population en matière de santé.
Merci beaucoup.
Thank you very much. Now we'll go on with a series of questions and answers. And I will give the floor to Dr. Tanquano. Okay, thank you very much, Dr. Giro. Thank you all the presenters. So I would like to say that adaptive management was applied here because, and we noticed it because at first, AmplifyPF, which is managed by Pathfinder in Burkina Faso, covered about 123 governmental healthcare facilities. But after the change that occurred in January of 2022, there's a new law, 7008 of the US government, which asked to suspend the support of the public sector healthcare facilities. So there were two possibilities. Either we suspend and do nothing anymore, or we change. And the adaptive management was used in order to redirect our support to non-governmental healthcare facilities which help the local populations. So as you heard it about what we did in family planning, we were able to keep working and support the health system through non-governmental healthcare facilities for the benefit of local population. This is what we call adaptive management, as we talked about earlier. So I would like to ask a few questions, especially to Mrs. Bero Liseta, a healthcare service provider. So what important changes did you notice during the last few months in your healthcare facilities? Thank you for your question. The substantial changes noticed in my organization is that I received a lot of training with the help of Amplify, which helped me to better understand what to do and how to respond to the needs of the clients, and the capability to offer several methods like IUD and implants, things I could not do before. And also, there were more technical equipments provided to help. So before that, if a client came, we had to ask the person in charge of the project, and if he wasn't there, we couldn't do anything. But now we have equipment, and that increased my skill, and I'm able to help clients when they come, patients when they come, and they are very satisfied. Very good, thank you. Thank you very much, Ms. Diabre, for your answers. Now we are going to talk with Mr. Congo Saka, who is the head of the Association for the Solidarity in Community Development. You said that before this intervention, you did not benefit from training, but also you didn't have equipment. So we can understand that this had boosted your key indicators. So I would like to know, before you received the support of Amplify, how were your family planning indicators? Thank you, Doctor. Thank you for giving me the floor. Yes, before we received the help of AmplifyPF, our indicators were pretty low. There was not much. The interpreter apologizes, but the sound is very bad. We had some equipment, but we had some contraceptive product, and of course, with all the things we received, products and equipment we received, the number of beneficiaries improved thanks to AmplifyPF, and we have been able to increase the number of beneficiaries and also the services provided to them in contraceptive services. We were able to use various contraceptive methods, and we received training in healthcare services. So all of these helped us provide support to the users, and a number of beneficiaries increased. For instance, in the first quarter of 2021, the report we had showed we had 89 new users, while the first quarter of 2023, we have 179 new users. So it's the number of new users are practically doubled. Thank you very much, Mr. Congo. Now, we are going to ask Ms. Kabore some questions. We saw through your presentation that there are several interesting aspects that you indicated as a result of receiving support to the benefit of non-governmental healthcare facilities. Among all those aspects, if you could mention the most important aspect that marked you most, what would be this aspect? Can we share with us what this aspect is? Thank you very much, Dr. Tanquano. We must say that since we started this collaboration with non-governmental healthcare facilities, we understood that had a need of support on a technical level, and we saw that there was a need to strengthen their capabilities and generate high-quality data, and the need to supervise and support and report. So in order to apply the new guidelines about healthcare services. As I mentioned it in my presentation, we started the collaboration by assessing, providing a basic assessment to have an idea of what was there, what was the background, and where we had needs and where there were obstacles. So when we started collaborating with those healthcare facilities, we understood what follows. First, there was the commitment of people in charge and healthcare providers. We noted that all along they were very motivated. They wanted to improve the services, healthcare services. We noticed that there were available services, available staff, human resources to provide a contraceptive method, long-acting contraceptive method. And there were several people. Before that, there was only one person who understood that, and when that person was not there, we had to ask people, patients, to come back again and again. But very often people never came back because they had to come back and it was too hard for them. But now we have human resources, we have people who offer services on a regular basis. That's a big improvement. The other aspect is about the need to access contraceptive products. And as we mentioned, there were interventions, and those non-governmental healthcare facilities did not have easy access to contraceptive products. As you know, if there is no product, there is no program and no support in this field. So we worked to strengthen the capabilities on a technical level, and also with human resources, and make sure they have access to product to provide services. And I have to say also that I want to talk about the mobility of the staff that we worked with, and we think that there have to be policies that enable to sustain the existing staff and make sure they don't leave after a short time. So this is what I wanted to say about our work with non-governmental healthcare facilities, because they cover one part only of the population, but we see that this part of the population is important. And so we have to have more intervention in order to help them by providing high quality services. Thank you. Thank you, Mrs. Cabore. I will now give the floor to Dr. Giraud to continue. Thank you, Dr. Tanquano. Mrs. Bergo, if you had to summarize in a few words your collaboration with the Amplify project, what would you say? Thank you very much for this question. My collaboration with Amplify gave me an opportunity to improve my family planning skills. And there is the health days that are organized on a regular basis. and there would be we had more medical and technical equipment that we could use in my healthcare facilities. So if this could continue in this way, that would be very helpful. And the training was also very helpful, and that enabled me to provide high quality healthcare services, because I could also use high quality data in my district and I could see what was happening. And this collaboration was a good opportunity for me, and I'm very happy that this project came to exist. A long life to the Amplify project. Thank you. Thank you. The next question will be to Mr. Congo. If you had to talk to other financial and technical partners, what would you tell them? What would you ask them? Thank you for this question. As a private sector organization, we would ask our financial and technical partners to extend this AmplifyPF project so that we could cover several health sectors. So it is only one part of the population. We have to cover a larger part of the population. And it is important to provide support and training so as to increase their work. To the other technical and financial partners, we are asking them to understand the impact of AmplifyPF and help the provider of healthcare services of the private sector to benefit from such support. It's very important. And I think because those non-governmental healthcare facilities have been helped, and the state, the government should help us also, because we noticed that the support of private sector healthcare facilities exist, because this cover a substantial part of the population. So they need to receive more support, and they'll be able to support a larger part of the population. Thank you very much. Thank you, Mr. Congo.
Série de questions et de réponses.
We're reaching the end of the Q&A session, and also the end of the presentation on the commitment of non-governmental players. So to set up, I'm going to bring a few points, and I will leave the floor for conclusion. So first of all, the non-governmental healthcare facilities can provide a high contribution in family planning for the population in Burkina Faso, not only on the rural sector, but also in urban areas. There are some private ones, but also some professional ones with religious leaders, and they provide quality services. But these health facilities need to reinforce their capacities. They need tool and equipment, but also input. So the government can help them as far as that is concerned, because these healthcare facilities, the governmental ones benefit from those services, but that's not necessarily the case for the non-governmental ones. So need for tools and services. They also need training and supervision, but also coaching sessions, so that the staff, which is recently hired or that doesn't necessarily have the right experience for specific services, they can now provide those services to the population. The other aspect is in terms of data collection. We need national data collection and also the interpretation of these data. And they use them themselves and provide them to the Ministry of Health. So I think non-governmental health facilities are part of the health system in Burkina Faso, and we need to support them so that they can serve the population. Thank you very much. Now I'm going to give the floor to Dr. Tanquano for the last words of conclusion. Thank you very much, Dr. Guiraud. Now we are going to open the floor to questions. Anybody who has questions, because you follow the presentation, you saw the movie, and you listen to the questions and the answers that were provided. Now we will give you a few minutes to ask questions. So I can already see one question in the chat. And it says that, is the delegation of tasks was taken into account into the implementation of the project? Madame Cabouret, can you please answer this question? Thank you so much, Dr. Tanquano, and thank you for the participant for this question. Yes, the delegation of task was taken into account at the community level, but also at the service provider level. And you saw it. We said it earlier. You saw it in the movie. Some methods of contraception were not available before, and thanks to the training and thanks to the delegation of tasks, those services are now provided. Yes, so that was the case. So this community health agents in the areas where we intervene do implement as well the task delegation at the community level. Thank you very much. Thank you. Anybody else would like to ask a question? I see some raised hands. I do not see any, so please let me know. Blaise Massimbo and Monsieur Cabouret also are raising their hands. Blaise Massimbo, Mr. Cabouret, do you have a question? So bravo to the team, to the teamwork and everything that was done. I'm an engineer in Burkina Faso. Two questions I would like to pose, please. The first one is about the profile of users, of PF users, the clients. What are their typical profiles? And also, second question, you use non-governmental healthcare facilities and not the private ones. I would like to know if there's a specific reason why you use that terminology. Because normally, we talk about private healthcare facilities, not the non-governmental ones. Now, I would like to have information about those days, those free days, those family planning days. Were the services free of charge? And if it was the case, who paid for them? Those are the three questions. And congratulations for the work that you have done. Thank you so much, Mr. Suleiman Cabouret. There were three questions. The first one is the profile of clients. maybe we can give the floor to the people who worked in those healthcare facilities. And maybe if the the Amplify team would like to add something, please go for it. Madame Diabri. Thank you so much, Dr. Tanquano. So we talked here, so before the intervention of the project, the service providers did not know the difference between the different types of client. And after the intervention, we trained them, we supervised them, and after that, the profile was much better managed. Thank you so much. Thank you so much. Why are we talking about non-governmental and not private? Why are we using this terminology? Thank you, Mr. Kabore, for those two remaining questions. Generally speaking, with partners, we have been using this terminology. And why non-governmental? Because you have the private one, money-making ones, we have the association ones, and the religious ones. If we keep private, if we use private healthcare facilities, they think about money, but we also have non-governmental ones that are not designed to make money. So by using non-governmental ones, they basically overarch. It's an overarching term that takes into account all of them. And now with regards to the last question, how we organize those special family planning days. During those special days, the services were provided for free to population. So who pays for them? As I said it earlier, with work together with other USAID partners that intervene in terms of procurement. During my presentation, I talked about supply chain TSM, and they provided for free for our experiment. They provided for free family and contraception products. So there's other inputs that are not taken into account, and that was supported by the Amplify project. So it's basically collaboration between ESAID that provided the products for free. And those days, it's basically those special days, those family planning days are happening over 3 days. Thank you so much. I would like to add something here by saying that
que ça soit Amplify, que ça soit le projet PSM, tout ça là, c'est l'USAID. Donc, c'est les financements de l'USAID. Alors, la collaboration
it's all being financed by USAID. And so the collaboration with that means that we organize our own structure and they work within that framework, but but let's not forget about the staff too. When it's done publicly, we cover a certain amount of products, but there is definitely a contribution. Oh, because we provide the structure and the staff. I see that Dr. Bambaha has a question. Can Mr. Suleiman Kabouret lower his hand, please? Merci. Thank you so much. Dr. Bambaha, thank you for the floor. I just would like to highlight what was said about those special days, because I believe, because Dr. Agenda is very interested. So those special days are preceded by 2 days of social gathering to create the demand and to inform as many clients as possible. Because basically so the message needs to be conveyed to the population, and all those who wish to can show up on those days. The other partners will provide the products. The other consumables are provided by USAID, so that in the end, the whole experience is free for the women, so that they don't have to pay the visit or even the little booklet that will be provided or the contraception. It becomes a fully free experience. And we also provide supervision during those 3 days. It is continuous offer, which is fully free. So the woman does not have to pay anything. Everything is paid for by USAID. Thank you so much. Are there other questions? I see in the chat box. And so what is the contribution of non-governmental health facilities? I think, I don't know, I believe we already have answered that question. Can the Amplify team or anybody who represents the healthcare facilities can, in one sentence, answer that question?
Oui, allez-y. Quelle est la contribution des formations sanitaires non gouvernementales? Je suppose que c'est par rapport aux journées spéciales.
Governmental healthcare facilities, especially in health desk. Thank you for this question. If it's about the special family planning health desk, the contribution of these non-governmental healthcare facilities is that they have staff that provide services, and it is something important. We have to pay the staff. So it means that we mobilize resources in order to supply services. Thank you. Okay, there's one more question. Maybe it is addressed to our partners of non-governmental healthcare facilities. What does the community association suggest to reduce the departure of duly trained agents? We thank you for this question. Yes, this is an issue for non-governmental healthcare facilities to sustain their personnel. We try to provide solutions, but as you know, human beings need to make progress to go from one job to another higher level job. So we have to make sure that they stay with us, and we have to offer a career plans for these members of the staff, and so give them perspective for future in their employment. So we help with professional training, and even we give them money to pay for scholarship in some schools. So we help them, and we want to make sure they are loyal and they stay with the organization, the healthcare organization, as long as possible. But of course, we need to get money for that, and we have to provide for their retirement fund. And so if we give this support, financial support to our staff, they are more likely to stay with us. So we'll continue with other questions. The next question is, what is the support that the Amplify project can bring to other partners who want to do the same thing? So what can AmplifyPF provide to other partners which want to replicate this model? Thank you for this question. What the AmplifyPF can provide is a technical support, because everything that is being done within the project is documented. So we have technical people who can help us with a project in order to show how we have done things in order to be able to replicate this. So, of course, the approach has to be adapted to the local context in which the project is implemented. So with the documentation, we think that there is, we can help partners who would be interested by this initiative and would want to replicate it. Then another question by maybe Aminata asking, what was the mechanism to collect data, and does the auto-injection of cyanide is taken into account? What was the data collection mechanism, and does the injection rate of cyanide was taken into account during training, but also in the fact that the product will be made available? I was going to ask Mr. Congo and the beneficiaries maybe to answer the questions. Otherwise, I can, no. Oh, yes. Thank you, Mrs. Cabore. So the mechanism to collect data was strengthened by AmplifyPF, which gave us additional documents that we fill out in order to make sure that we record our services, and we work with the ministry to try to make available means to collect data about family planning. So we fill out these documents to give information on a monthly basis, and they are then transmitted through the district level organization, and then they are compiled and analyzed. And also Pathfinder has given us documents that enable us to provide high quality data, and especially concordance between among various parts of the project. So this is to have a real data collection mechanism in place. Doctor, if I may, I would add something to this answer. I must say it is the same mechanism of collection and transmission of report to the higher level has been adopted by the ministry. So it means that the data of healthcare facilities is transmitted every month. There are reports about their activities, and the data that we presented here come from the system. So Amplify doesn't have a parallel system of data collection, but we use the existing system. And as Mr. Congo said, we organize, for instance, a review and validation session for the data in order to ensure the concordance and consistency among the various primary tools and what was communicated in the activity report and transmitted to your higher level. So I wanted to add this. It is the same system we are using. Thank you very much. Can someone answer about the auto-injection in Cyanopress question? Is the auto-injection of Cyanopress is taken into account? Doctor, if I may, yes, go ahead. Yes, I would like to indicate that auto-injection of Cyanopress is taken into account when you talk about the supply of services, and we trained the providers to increase their skills in this regard, and we developed support for auto-injection of Cyanopress to the plan. So I want to reassure the person who asked the question, yes, it is taken into account. Thank you. Thank you very much. And we have 3 more questions. Mr. Kagate, we asked 2 questions. The first one, is there a sustainability plan so that the services may continue in the non-governmental healthcare facilities after the end of the Amplify project? This is the first question. Should I respond or you want to respond? No, go ahead. Thank you. So at this level, as we said during this experiment in Burkina, there is a possibility for non-governmental healthcare facilities to enroll in agreement with the Ministry of Health and register in order to develop the free care services for family planning for the population. So when during the implementation, we really support and encourage the non-governmental healthcare facilities to agree to this and sign this agreement in order to keep providing free services, just like the healthcare facilities of the public sector. So this is what I wanted to do about the sustainability of the help of these healthcare services. The second question by Mr. Levant is, will the government continue to provide contraceptive product? I think he meant to keep helping the non-governmental healthcare facilities in contraceptive products. I think the answer is the same answer as what was given about this agreement that was mentioned earlier. And I think if healthcare facilities are interested and if they want to sign this agreement with the Ministry of Health, I think that there will be a continuation of the provision of these products. And here, I want to just to stress that even non-governmental healthcare facilities can receive free contraceptive product as well as the public sector healthcare facilities. I just wanted to add here that there are 3 actors. The first one is the organization that are supposed to increase capabilities of non-governmental healthcare facilities by training their staff, provide them with medical technical equipment necessary. And so this is about these actors in the USAID project and projects from other partners. The second actor, it is the government, which must make sure that these organizations can receive products, but also that they can benefit from the supervision from the public sector, because non-governmental healthcare facilities are part of the healthcare system, and a head of a district should supervise what is happening also in these facilities. So not only public sector facilities, but also private sector facilities. The third actor is the system of training for healthcare support, because it should be connected to the free care policy. So each actor must be able to play its part. It is a partnership, and these three actors must each be able to do what is expected from them. That's what I wanted to say. And the last question here for now is, I think, is for the Amplify team. You have talked about 57 organizations out of 81. So what will you do for the remaining 24 non-governmental healthcare facilities? Did you hear my question? Yes, thank you to the presenter for this question. It is true that the organization were admissible were 81, but as I said, we started our intervention last May, and based on the available resources and the time remaining, we thought we should not cover all these organizations. We didn't have enough time or staff. So we focused on a first group of 57 non-governmental healthcare facilities, and we have continued our advocacy, and we hope to get more resources and more partners, which may be able to help us provide training to the other healthcare facilities. So it's based on our resources, and also we are close to the end of the project. And this is why we are in this situation where we have not been able to take charge of all 81 non-government healthcare facilities. But if there are other partners who are interested, it could help. It would be great if they could provide support. Thank you very much. If you allow me, I wanted to add one word. As was said, there's a lot left to be done. And I want to say that there are not only 81 private healthcare facilities. This list is not exhaustive. The 81 number that mentioned, it doesn't cover all the non-governmental healthcare facilities. So there's a lot more work left to be done, and our partners may want to invest to help those other healthcare facilities of the private sector. Thank you very much. I think we should not forget that USAID in Burkina, USAID is there, is ready to help. It's a very important partner which is represented in this webinar. So now there's one more question.
Agboko from Benin ask a question. What are the advantages of non-governmental health care facilities in providing free services? So in other words, what do they gain by offering these special days and by providing family planning services? Thank you for the question. So those special days, those special family planning days, which provide free services to the population, for us, many people benefit from this free family planning. And it also provides great visibility to those who didn't know the services. It increased communication. So it's basically awareness. It provides great visibility, great awareness of our policies. But they also didn't know that we had a non-governmental healthcare facility in that area. So to sum it up, it is a positive thing for everybody. Thank you so much. Thank you so much. Another question. I think it's the Amplify team. Do we do advocacy work to other partners in terms of these type of activities to other partners? I'm not sure who this question should go to. Is it me or Ms. Cabret? I think it's all of you. I said it earlier, especially with the movie that you watched it. It's the first time those partners support us in this area. So yes, we do advocacy work, but with not great results. So it's a great opportunity here to reiterate the advocacy work so that we can receive your help because we need it. Thank you so much. We need your help. And to add to what Mr. Congo said, what we are doing is also advocacy work to other partners. And when we have the opportunity, we communicate this type of experience, what we experienced during those days with other partners. Because before anything, as far as we're concerned, it's the same citizens of Burkina Faso that go to the public or the private one. So if the services are of good quality, then they will encourage them to go. Thank you so much. I'm only picking up questions here. Is the Ministry of Health aware of the incredible work that you do? Yes. Yes. Thank you for the question. We do not work in parallel with the health ministry. And everything we do, the Ministry of Health is aware of it. You have the testimony of the first person in charge, Mrs. the director of the Ministry of Family. She, you could have seen it on the video. It was and on the field, in the field, everything that we do is well known to the Ministry of Health. And they also support the process. Thank you. And while supporting and accepting the restrictions and the rules, etc. Thank you so much. I think we have gone over all the questions. I see a raised hand. Mr. Cabret? Let me come back to what I was saying earlier. Madame Cabret said something interesting, and which encourages me to ask another question with regards to the profile. When you say that it's the same type of citizens and the same public, it piques my curiosity here. Is there a specific type of clients or beneficiary who normally go to the private sector and this time benefit from going to non-governmental ones? So what is their profile? So the one who benefits from these type of services, this is not a specific type of client that attend these type of health facilities. All profiles are accepted and welcome. When we talk about non-governmental and this is where we were specific. Under non-governmental, we have lucrative one, that's money-making ones, also health facilities that are community-based or religion-based. So all types of clients come to those healthcare facilities. So maybe Mr. Congo would like to talk about the profile of the users, of the client, of the non-governmental ones. Thank you so much. Thank you so much, Madame Kabouret. Any client can go, when a client comes to us, and when it's free, they come back. So it's basically, it encourages repeat customers, repeat clients.
Voilà. Je voudrais dire par rapport à la question du profil qu'en fait.
So with regards to the profile, the clients
fréquentent la formation sanitaire. Des fois, il y a aussi la motivation.
Their motivation might be a little bit different. And this is what's going to influence the type of client. Maybe the social economic profile is lower. Sometimes the non-governmental health facilities, sometimes they show up for contraception and don't have the means for them. So for example, for the implants insertion, the cost will vary from 2,000 to 4,000. So there's some non-governmental ones who accepted to insert the implants to women who don't have any money at all. So it's all profiles. That's the short answer. We all agree that financial accessibility reduces the access to private healthcare facilities. Those free days, really, those PF days, those special days really bring in a lot of different clients, especially the ones that don't want to pay for it or can't pay for it. So unless we do a very specific study to study the profile, the economic profile of these women, for now, I would say that all types of women come to those special days and benefit from these type of services. So there was no study done to provide a specific profile. Thank you. Another raised hand. We just have 1 minute left. So let me give now the floor back to Dr. Guiraud. But before anything else, I believe that non-governmental healthcare facilities can play a key role in the free provision of family planning. And we know that our cities have a lot of people that really need, especially in the suburbs, that need family planning. So this experience shows that we can offer free services to this type of population. It is key that we take into account these healthcare facilities. However, these healthcare facilities need to provide data, because if we do not report data, there will always be an underestimation of the work that gets done in terms of family planning. And that means we will have a greater offer, but a reporting that doesn't reflect reality, and therefore we can't really appraise or have a great evaluation of the work that gets done. I think it's an interesting experience, and I would like to end by saying that some people say that, why did you work with these healthcare facilities? I can guarantee you that regional directors, doctors, and even high commissioners told us, thank you so much, because you, through this experience, you really removed the thorn on our sides, because we don't have enough resources to meet the demand of healthcare facilities in the public sector. And you have arrived and you are providing great services. So not just in terms of equipment, we also gave them information and reporting and data. So all the tools, all the reporting tools that exist on the public sector, we have used them. Some doctors told them that they lost sleep because they don't have the data. Unfortunately, the non-governmental healthcare facilities do not yield enough revenue. But now, thanks to that change, we will understand the real performance of health districts. And when we looked at those healthcare facilities, we know that now the Burkina population goes there. So we have the duty, regardless where the state or the partners, if we want to meet the demand, we need to focus on the sector. So thank you so much to everybody who talked today, who presented. Thank you for your questions, for your attention. Mr. Moderator, you have the floor. Thank you so much. This is the end of our webinar, and I'm going to conclude by saying, it's true that Amplify was a great success, as you saw it, in terms of support for healthcare, non-governmental healthcare facilities, but much remains to be done. So the government needs to intervene, and also other partners. So to support the local healthcare facilities. I'm going to leave the floor to Mr. Barry for the conclusion. You said it very well already. We will share the contact of Gisèle Caboret, who will be able to answer final questions. So there was also a question about disabled people. I'm sorry we went over time, but we will share the contact information so that you can ask your question. So this is the end of the first webinar out of 4. Thank you so much for your participation. The next one will take place on April 27th. So that's in 3 weeks, on the theme of mobilization approach of local resources by technical committee to support health facilities in Niger. We hope we will count you as participants and attendees. Thank you so much. Thank you so much. Thank you and have a great rest of your day. Thank you all.